Welcome back to ophthalmology for undergraduates and postgraduate beginners. Today I am going to discuss about a short case. First we will see the patient. The patient you just now saw is presented with the following symptom: irritation in the right eye that is there for many years. That was her complaint. When you examine this patient or when you see this patient, you can see that there is a small opacity in the lower 1/3 of the cornea. Now let us see the patient's entire face. In this video, we can very well appreciate that the right eye is widely open. The lower lid, when the eyes are open, normally it should be at the level of lower limbus. But in this case, you can obviously see the lower lid is very much below the lower limbus. The upper lid is also not covering the cornea properly. When the patient is asked to close and open the eyes, the right eye, the patient is not able to close fully. So, this is called as Lagophthalmos, that is inability to close the eyes fully. This patient is also having deviation of mouth towards the left side. I have not shown this in this video because I don't want to completely reveal the patient's image in this video. There is deviation of mouth towards the left side. There is absence of wrinkling on the forehead on the right side. The eye is not able to close fully. There is absence of labial fold on the right side. So all these things point that there is a lower motor neuron type of facial paralysis on the right side. Now let us learn what are the causes for Lagophthalmos. Let us make it very simple. The lids are not able to cover the eyes. That is called as Lagophthalmos. It may be due to a large eyeball which cannot be covered by the normal lids. The large eyeball may be due to an anterior staphyloma, a Lagophthalmos or congenital glaucoma, or when the patient is having a very high myopia, the eyeball will be very large. So, the lid is not able to cover it. The lid causes. The lid itself is at fault. It may be due to a facial paralysis, which we saw in our case. It may be due to ectropia, that is the outward turning of the lid, which does not cover the eyeball, or it may be due to laxity of the lid muscles. We have seen several people having this lid laxity, and when they sleep, they have a nocturnal lagophthalmos. You might have observed in people sleeping in a house, that too particularly elderly people, they have their eyes incompletely closed while sleeping. So that is due to lid laxity. The third one is the eyeball is coming out. That may be due to proptosis or exophthalmos when it is caused by thyroid diseases. There may be so many other causes for lagophthalmos. I am not going into that. Now let us see what are the problems a patient with lagophthalmos can experience in their eyes. The first thing is, because of the incomplete closure of the eyes, the tear fluid is not going to properly spread over the cornea and conjunctiva, leading to dryness, that is dry eyes. The patient will present with irritation of eyes. The second thing is, the eye is exposed to all the atmospheric dust particles and foreign bodies, and it is easily getting traumatized, leading to exposure keratitis. Once this exposure keratitis, what we have seen in our case, which is usually present in the lower half of the cornea, if it is not properly taken care of, that can lead to corneal ulcer formation and corneal opacity and blindness. Now let us learn what is Bell's phenomenon. Whenever we close our eyes, our eyeball will rotate upwards and outwards. The cornea will not be in the center. It will rotate upwards and outwards. That is called as Bell's phenomenon. You can see in our patient also, the eyeball is rotating outwards and upwards, but in spite of its rotation upwards and outwards, the eye cornea is not fully covered because of this lagophthalmos. So this is a very dangerous sign. This patient will definitely lead to dry eyes, exposure keratitis and corneal ulcer and blindness someday. If the lagophthalmos is not so severe like that in our case, then the cornea might have hidden by this Bell's phenomenon, and the patient may not get a severe problem in the eyes. But it is not so in our case. Now let us see how to treat this patient. Coming to the treatment of this lagophthalmos, if the problem is in the initial stages, that is the patient is having a facial paralysis only for a very short duration now, you are expecting the facial nerve to become normal within few days or few months, then we can try the following things. One is tear substitutes. The tear substitutes, that is the artificial tear eye drops, can be applied to the patient's eyes so that the eye does not get dried up and the patient does not have any irritation, or the patient does not develop exposure keratitis or corneal ulcer. The second thing is protective goggles. The patient can be asked to wear goggles covering the eye so that the eye is not exposed to the dust and other traumatizing substances. The third thing is taping together of the lids after fully closing it, just like that what we have shown in this picture, particularly during the time of sleep. That way, if we do, then we can protect the patient for some time until the normal recovery occurs. Sometimes the disease process that is leading to Lagophthalmos may not be expected to recover yearly due to some reasons. In that case, we cannot try the temporary measures. We have to go in for a permanent measure of treatment. What is a permanent measure? That is tarsorrhaphy. Tarsorrhaphy means tying the lids together. If the Lagophthalmos is very severe, we have to do a centrolateral tarsorrhaphy. So we start the tying of the lids from the center outwards. So that is what is shown in the lower picture, that is centrolateral tarsorrhaphy. If the Lagophthalmos is very mild, then we can go in for a lateral tarsorrhaphy, that is lateral 1/3 of the lids alone sutured together. So this is how we treat the patients having Lagophthalmos. With this, I am going to stop this here, and so many things can be learned from the book. I am not going to the depth now. Thank you.